Hello, my name is Alejandro, and today I'm going to talk about Tezacaftor-Ivacaftor in residual function heterozygotes with cystic fibrosis. Definition: Cystic fibrosis is an autosomal recessive disease caused by mutations in the CFTR gene that lead to progressive respiratory decline. Some mutant CFTR proteins show residual function and respond to the CFTR potentiator Ivacaftor in vitro, whereas Ivacaftor alone does not restore activity to the PHE508 del mutant CFTR.
In lung airways and passages in other organs, cell surfaces have tiny proteins called CFTR. These act as channels for chloride ions to regulate the movement of salt and water in and out of cells. In cystic fibrosis, this process is disrupted because of a mutation or error in the CFTR gene, which provides the instructions for making CFTR protein channels. As a result, thick, sticky mucus builds up in many organs. Some CFTR mutations can cause what's called a gating defect, where the CFTR protein channels are present at the cell surface but fail to open correctly. Kalydeco is designed to keep CFTR protein channels at the cell surface open longer to improve the transport of salt and water across the cell membrane.
Applications in medicine. Vertex Pharmaceuticals, a clinical-stage biopharmaceutical company, recently announced that two phase 3 studies evaluating its Tezacaftor-Ivacaftor combination therapy have shown statistically significant and clinically meaningful improvements in lung function in patients with certain mutations associated with cystic fibrosis.
Indication and important safety information. Kalydeco is a prescription medicine used for the treatment of cystic fibrosis, or CF, in patients aged 6 years and older who have a certain mutation in their CF gene called the G551D mutation. Kalydeco is not for use in people with CF due to other mutations in the CF gene. It is not effective in CF patients with 2 copies of the F508del mutation in the CF gene. It is not known if Kalydeco is safe and effective in children under 6 years of age. Kalydeco should not be used with certain medicines, including the antibiotics rifampin and rifabutin, seizure medications, phenobarbital, carbamazepine, or phenytoin, and the herbal supplement St. John.
Pros and cons. Pros. Tezacaftor-Ivacaftor was very well tolerated, which makes it an important potential new option for helping patients feel better and change the course of their disease. The fact that Tezacaftor-Ivacaftor will be the basis of triple combination therapy makes this positive data even more exciting for patients with CF and the physicians who care for them. Cons. The most common adverse events, regardless of the treatment group, were infecting pulmonary exacerbation, cough, headache, nasopharyngitis, and sputum increased.
Kalydeco can cause serious side effects. High liver enzymes in the blood have occurred in patients taking Kalydeco. Regular assessment is recommended. The most common side effects associated with Kalydeco include headache, upper respiratory tract infection or common cold, including sore throat, nasal or sinus congestion, and runny nose, stomach or abdominal pain, diarrhea, rash, nausea, and dizziness. These are not all the possible side effects of Kalydeco. Patients should tell their healthcare providers about any side effect that bothers them or doesn't go away.
Issue applied in Ecuador. In Ecuador, the results are particularly exciting because they demonstrate that by addressing the underlying cause of cystic fibrosis. The Tezacaftor-Ivacaftor combination offers significant benefits for many people with this severe and life-shortening disease, while also offering increased over Kalydeco alone in patients with residual functional mutations.
To me, that suggests that some of the damage that has been done to my lungs, and there's a lot of it, has been reversed. And that's actually insane because CF is a progressive disease and it only gets worse as you get older. So to have an experience of feeling better for a longish period of time than you have for years is very spooky. And I almost haven't wanted to talk about it out loud because it's like a rabbit and I don't want to scare it away. So when I say that my lungs feel like they've gone back in time a bit, I mean that I haven't been coughing nearly as much as what my baseline has been for the past couple of years. I am able to walk longish distances without coughing or wheezing or being short of breath, and my body is able to.
Conclusions. CFTR modulator therapy with Tezacaftor-Ivacaftor or Ivacaftor alone was efficacious in patients with cystic fibrosis who were heterozygotes for the PHE508 del deletions and CFTR residual functional mutation.
The discovery of Kalydeco by the scientists at Vertex was made after testing thousands of chemicals in cells containing CFTR. One of those chemicals ultimately became a successful medicine, only it required modification so patients could administer it orally, and so it would last the correct amount of time in the patient's body. Two 48-week placebo-controlled clinical studies involving 213 patients were used to evaluate the safety and efficacy of Kalydeco in cystic fibrosis patients with the G551D mutation. In both studies, treatment with Kalydeco resulted in significant and sustained improvement in lung function. Kalydeco is proven to be a financially viable medicine for Vertex. Its net product revenues in 2012 were $171.6 million, following FDA approval in January of that year. In addition to helping the 4% of cystic fibrosis patients with a particular CFTR mutation, there are currently 3 label expansion studies to determine if the medicine may one day be able to help more people with cystic fibrosis.
Thank you for your attention.